The reason that I'm making this video is because I didn't find anything similar on the internet, and we think that when we have a root canal procedure, it either goes well or it doesn't. I think there is something in between, and that's what happened to me. So back in July 2019, my face got swollen. I went to the dentist and they said, oh, all of your teeth are great, we don't know what's wrong. They've done an x-ray and they noticed that I had abscess in my gum, and basically the tooth was perfectly fine on the outside, but because I was wearing braces, something happened. Either they tightened them up and damage the root of the tooth, or maybe, you know, when you're a kid you may be playing with balls and something happened. And anyway, they decided to perform a root canal procedure on me. It happens in 2 stages. So the first one was to clean the abscess and add a cloth with antibiotic on it, and then after a week remove that and complete the procedure with filling up the tooth. And after that they told me that I will experience some sensitivity or even more abscess will come out in 1 or 2 days from the gum. I was like, right, okay, no problem. I experienced lots of pain. They told me to take ibuprofen. Then that continued for a week, 2 weeks. On the second week I started freaking out. I was thinking I needed to go and search on the internet. I couldn't find any solution. I was going back to the dentist. They were saying that the tooth is perfect, it's been perfectly cleaned. And I was telling them, but I am in pain. And the pain was very strong. I would feel it here, inside my gum and inside my nose. It was expanding on the side of my face. Even I would even feel pain in my ear. They told me maybe you're clenching your teeth at night. The bad thing is that I do that as well. So I was thinking, but why did that get worse after the root canal procedure? And that continued for a month. The dentist was bored of me, literally, and they told me to go and get a CT scan. Obviously, I live in the UK, and CT scans, if you go privately, they're crazy expensive. If you go through the NHS, you would have to wait for 4 or 5 months. And thankfully, my work partially pays for an insurance, so I've done that privately. So I even had a CT scan, and they were worried that sometimes when you get your root canal procedure, when they're filling the tooth with that material, some doctors may push it further up and they may push the inflammation and the abscess into your nose. Thankfully that didn't happen with me because the CT scan came clean. I told the doctor, so what's wrong with me? Like, I'm in pain here, down to my jaw as well. What's wrong? And they couldn't find what it is. So I've started doing some research here and there. I also asked my uncle that is a dentist in Greece, and we came to the conclusion that many times when we have abscess in our gums for a long time, because mine, the damage started happening, I think, years ago. It's my canine, and it used to be slightly darker than the rest of my teeth, which was very weird because I keep brushing my teeth 3 times per day. And so I think that the damage to the nerves started years ago, and over the years I started having abscess in my gums. So when you remove an inflammation that has been there for weeks, months, or even years like me, your body goes through a shock. It's like having a wound inside your gum. So if you're experiencing pain, it's very normal. Mine went away after 2 months. So if you're experiencing pain, don't really worry. I would suggest that call your doctor just in case and tell them what you're going through, because maybe there is a very, very small chance that they didn't know what they were doing and they didn't clean it properly. But I think it's way more common to experience pain than actually having the inflammation building up again, the abscess, sorry. Call your doctor, tell them where the pain is. It's better if you get it checked anyway, and if they tell you that it seems fine, we've done an x-ray, it's clean, we don't know why you're experiencing pain, most likely it's just your body healing, and be patient. Usually they say that it will be better after 1 or 2 weeks. Mine took 2.5 months, so it depends on how long you had the abscess. So if you have any questions and I can help, just leave a comment below, and I hope you relax a little bit, because it affected me mentally. I thought that something's wrong with my face.